Hi, it's Christina with the Sisyphean Journal, and another video came up in my YouTube feed about potential lawsuits regarding transing children. And people look at the appalling things that are done to these children and think, oh boy, have they got grounds for lawsuits. But, my time I spent at Life Dynamics, we were doing litigation support for abortion lawsuits, and if there's one thing I've learned, it's that lack of informed consent counts for diddly squat. You paid to get the pregnancy terminated. It was terminated. You've got no grounds to complain about whether you were properly walked through that choice. You got what you paid for. And I think it's going to turn out to be the same thing in any trans cases where they're like, you didn't explain to me fully what was going to happen, what was this going to mean in my life. Because they never explain that prior to an abortion, and they're never held accountable for it. And I want you to keep in mind as I'm telling you this story, exemplifying how lack of informed consent isn't considered grounds for a lawsuit in an abortion case. I want you to think about the contrast between this young woman's story and your typical trans story. By the time the child gets to a facility, that child has already been coached into demanding that they be transed. They're coached on threatening suicide. So they can point a lot less of a finger of responsibility at the facility than this young woman could toward her facility. So I want you to be thinking in parallel, thinking about these transing lawsuits and what kind of a chance they possibly have when you look at what happened to Nancy and the fact that she was told, look, you got what you paid for, shut up. Okay. So Nancy went to Fargo Women's Health Organization on January 29th of 1988. So the primary issue in her case hinged upon informed consent. Had she been adequately prepared for what she might experience? So Nancy said that she'd been uncertain about the abortion. And on her pre-abortion paperwork, when choosing the sentence that most captured her feelings, she said, I have some conflicts with my decision, but feel abortion would be the best. Now, in normal medicine, if somebody has some qualms about going through an irreversible procedure, it's considered the doctor's responsibility to clarify, look, these are what the long-term ramifications are. Here are the less irreversible options. We could go for psychotherapy. We could refer you for job placement. We could help you get housing, whatever. That's not the case in abortion. Abortion's irreversible. You would think that if somebody has qualms, they would not proceed. But that is not the case. Now, Nancy's attorney described the pre-abortion counselor as a woman whose sole credential for work in abortion counseling appears to be the fact that she had an abortion. And if you look at David Reardon's book, Aborted Women Silent No More, he found that very common, that post-abortive women who were traumatized by the experience would often try to cope by becoming abortion clinic counselors. Because if you do something where you feel like you did the wrong thing, you feel kind of better about your choice if other people in that situation are making the same choice. So every woman that they counseled that went through with the abortion validated their decision, and they were trying to feel better about it by doing that. Nancy testified, I expressed many, many times I was unsure of the decision, and the counselor kept pushing. And the counselor noted in her deposition that Nancy did indeed express moral conflicts with her decision. Now, did this counselor help Nancy to sort out her moral qualms so she could be confident in her ability to live with her choice? Or did the counselor focus on pushing Nancy past her moral qualms? And I wish I could find the original. They had done a study of Planned Parenthood options counselors. And they did not feel that their job was to help the woman sort out what really was best for her. They felt that their job was to help her to overcome her qualms so that she could go through with the decision that was already best for her. And I went to a political women's conference one time and ended up seated with a Planned Parenthood manager. And I told her about my babysitter who was duped into an unwanted abortion. And, you know, the Planned Parenthood administrator was like, well, if she didn't already know she wanted an abortion, she had no business walking into a Planned Parenthood. Typically, a lot of these abortion clinics, their thought is if you walk through the door, your decisions is made up and it's our job to get you through it, not our job to explore whether other options are better for you. And that's why the women walking into the stork buses outside end up changing their minds so often, because there was nobody beforehand to walk them through that. Now, contrast that with by the time the young person gets to the trans practitioner, they've already been through all the, oh, this is best, this will resolve all of your problems. Okay. So, Dr. George M. Mix, the abortionist, estimated Nancy's pregnancy at 10 weeks. And he said he asked Nancy before inserting the dilator if she wanted to proceed, and he said yes. And she said yes. Nancy said Dr. Mix began the procedure almost immediately after he came into the room. Again, this sounds very typical for abortion practice. The woman's already prepped. She's in the stirrups. She's often already sedated, sometimes even unconscious. And the doctor just walks in and does his thing. It's an assembly line. I began to breathe rapidly and hyperventilate. He instructed me not to protest. He said I could take the pain. Finally, when I screamed, they said I had become uncontrollable, and he quit the procedure. Dr. Mix's last words to me were, I don't have to take this, and he quit the procedure. Now, in a deposition, Mix agreed that the abortion was an ordeal for both him and his patient. He described Nancy as uncooperative, saying, she moved around quite a bit, making the procedure difficult. She screamed and carried on, or at least verbally, she was quite loud and carried on in such a way that she had difficulty listening to instructions. Now, he disputed Nancy's assertion that he got fed up and decided to finish. And Nancy definitely was screaming. Clinic employee Susan Sharon said, I was sitting at my desk and I heard screaming and I thought I would go downstairs and see if I could help, but she decided there was no need to help because they had just finished. And Sharon said that when she talked to Mix about the situation, he was a little upset. He said to me that she was rather difficult and he didn't think he wanted to go in and see her again. So he's not even wanting to provide post-abortion care because he's upset with her. Clinic director Jane Bovard also heard Nancy screaming. She said in her deposition that she'd been told Nancy had been screaming, thrashing around, and hyperventilating during the abortion. She didn't feel any need to discuss the situation with Mix, though, because it happens enough that I wouldn't find cause in him to ask about it. So both sides are agreeing that Nancy was in so much pain she couldn't stay still, and the staff even indicated that women screaming in pain was not out of the ordinary. So was it Nancy's fault that she couldn't stay still, or was it the doctor's fault for not providing adequate pain control? Now, a clinic employee notified Bovard that Mix had not removed the entire fetus. She said, I went and talked to Dr. Mix. I asked him how he was feeling about this. He said to me, I clearly identified all the significant parts. I saw the calvarium, that's the part of the skull that contains the brain. I saw the spine. I saw the extremities. She does not need to be resuctioned. So he had examined what he took from her uterus, and he knew that he had not gotten all of it. He'd gotten a skull case, he'd gotten a spine, he'd gotten the limbs. Now, clinic staff said that Nancy didn't remain in the waiting room for half an hour after the abortion as instructed. I find that interesting. They didn't move her to a recovery room where she could be properly monitored. They just stuck her back in the waiting room where she could walk out early without being medically cleared. And they said that she thus missed out on medications and aftercare instructions. And Mix said that this meant Nancy hadn't been told about the possibility of minor bleeding, passing of tissue, and needing to return to the clinic in 2 weeks for a follow-up. Now, shouldn't she be kind of warned about the possibility of bleeding and passing tissue before she signs the consent forms? I would think so. And this conflicts with their later assertion that Nancy had been made fully aware of what might come out of her body after she got home. Now, 2 days after the abortion, Nancy had just gotten out of the shower and gone into her kitchen. She said, I noticed a loud splat. I heard something fall out. I reached down to examine it. I thought it would be a blood clot, and I found in my hand the face, shoulders, and arms of my baby. So, think about pro-choice woman being told all her life that abortion just terminates a pregnancy, that there's nothing like a baby, there's a potential baby, the potential for a baby, it's a blob of tissue, it's undifferentiated tissue, it's tissue the size of a grain of rice, blah, blah, blah. You've heard all the things that abortion advocates say to justify the idea that abortion doesn't kill a baby. And I wind up of two minds in cases of women like Nancy. Part of me is like, well, what did you expect, a gerbil? But part of me also feels sorry for them because the people they trusted them just said tissue, 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 tissue. You might expel some tissue. You would expect to be forewarned if you might see the mangled face of your baby staring up at you with dead eyes. And she was not warned about that. Hold on, I pause. I'm burning my dinner. Okay. So Nancy said she called the clinic and told Sabbath what had happened. And Sabbath said that since Mick said he'd gotten the entire fetus, which he hadn't said, he said he'd gotten the skull case, the spine, and the limbs. Nancy was either just seeing uterine tissue or the remains of a twin. Nancy said Sabbath told her, you passed it, take your antibiotics, since your bleeding is normal. There's no need to take it in. Just get rid of it. Put it behind you and be calm. You will be all right. Nancy felt that Sabbath was trying to talk her out of going to the hospital. Now, Sabbath agreed that Nancy had called at 6:48 a.m. on January 31st, saying that she had passed a head and an arm. Sabbath said in her deposition, she was screaming and yelling at me. And she added that Nancy's husband got on the phone and said that he was going to sue. Now, after calling the clinic, Nancy called two friends. One of them came to her home, grabbed the baby and the tissue paper in which the baby was wrapped from my husband Mark's hand and was crunching it up like she was going to flush it. Mark grabbed the tissue and my baby out of her hand. She wanted to flush my baby down the toilet. She kept saying, put it behind you. Now, what is it that Nancy had seen, okay? The clinic administrator saying, it was just some tissue. It's just some tissue. Nancy took the tissue with her to Med Center 1 emergency room. A hospital pathology report described it as parts of the human fetus, including the entire face, 2 arms, and a portion of the rib cage and back. And Nancy underwent a D&C to remove any remaining tissue. Now, the clinic argued that since a 10-week fetus is only an inch long, doctors don't typically inspect the tissue to make sure they got all the parts. But this disagrees with the testimony. Mick said he did look at the tissue, identified the calvarium, skull, and extremities. And since the calvarium is pretty much the skull minus the face, Mick effectively admitted that he had left behind Nancy's unborn baby's face, complete with the bony structure. He said he'd removed extremities, but not that he'd gotten all 4. And he didn't say he'd removed the entire rib cage. So, Baby Center, which is a website for expectant mothers, said that about 10 weeks into pregnancy, your baby is about the size of a kumquat, which is about 2¼ inches. But the plot thickens. During the trial, Mix testified that he calculated that Nancy was 10 weeks and 5 days into her pregnancy, but he noted in medical records that she might have been 12 weeks. And if we go back to Baby Center, that baby would have been the size of a lime, about 2.13 inches from crown to rump. And I have clicks. I'm going to link below to my article about this, and you can follow the links and see. And you can conclude for yourself if this is what Nancy could have reasonably been expected to know she would see if she expelled retained tissue. Now, the clinic went on the offensive. Jane Hodgson, a prominent abortionist with more than 30,000 abortions to her discredit, but about 5,000 live ones, that's a 6-to-1 dead babies to live babies ratio, said the expulsion of a small portion of fetus at the plaintiff's home, although painless and relatively bloodless, was unfortunate in view of her now apparent history of chemical addiction and hysterical personality traits. Retained tissue is a well-recognized complication of early abortion. So note the terminology there. The consent form said missing all or part of the pregnancy. Now, if you were told you might expel tissue or all of part of the pregnancy, would you expect to see the face of your dead baby staring up at you? Nancy reported severe trauma from that sight, including frequent nightmares of holding a baby in my hands, having a complete face and looking up at me. And according to the hospital pathology report, that's exactly what she experienced. This was not a bland passing of a few blobs of tissue or an ill-defined pregnancy. Pregnancy is a state of being. Pregnancy is a state. Saying that we're going to remove the pregnancy is like saying we're going to, when they're doing trans surgery, saying we're going to remove your femininity. You know. And how had they screened Nancy? Okay, so Hodgson, who is testifying on behalf of the clinic, dismisses Nancy as, oh, she's just some hysterical, whiny, she shouldn't have worried her pretty little head. The plaintiff's alleged injuries, if any, are grossly exaggerated without any basis in fact or law. This despite the hospital pathology report that says that, yes, she saw her baby's face staring up at her from the kitchen floor, the face, shoulders, and arms of her aborted baby. A psychiatrist who testified for the clinic essentially said that Nancy had already been such a drug-addled nutcase prior to the abortion that it hadn't made her any worse. All of her problems were due to physical and mental abuse from others in her life, and that she had a responsibility to tell the staff she was emotionally fragile. I got the picture of a woman who thought her own life was very interesting, very unique, and extraordinary, and noted that Nancy had a pre-abortion diagnosis of atypical personality disorder. Now, shouldn't they have been screening for emotional instability before sending her home, knowing she might end up with the face of her dead baby staring up at her from her kitchen floor? So Mix in particular blamed Nancy for being in so much pain that she was writhing and he couldn't get the whole fetus out. So in the end, the jury sided with Mix and the clinic that Nancy was such a drug-addled lunatic who willingly consented to an abortion after being made fully aware that she might expect a recognizable mangled dead baby to fall out of her. They didn't seem to fault Mix with failing to provide adequate anesthesia to avoid this incomplete abortion in the first place. And, you know, they're like, well, you know, you paid to get the pregnancy terminated, and it was terminated. Now, Nancy appealed the case on multiple grounds, but the clinic and Mix insisted that Nancy foot the bill for the entire court transcript, over $7,000 in 1993, which is nearly $14,000 in today's money, to pursue the appeal, and she couldn't afford it. So the appellate court just threw it out on the grounds that they had insufficient information to make a decision. So think about this. This is a woman who went in ambivalent, having moral qualms. They pushed her into the abortion. They did not provide adequate care, adequate pain control so that they could perform a complete abortion. They only told her she might expel tissue or part of the pregnancy. And when she goes home, and this is what falls out of her, and she gets told, suck it up, buttercup. What do you think is going to happen to these kids who threaten suicide in order to be transitioned? They don't have a snowball's chance in hell. Nobody is going to let these go through court cases. These kids are going to get, you got what you paid for. You wanted your birth sex to be gone. It is gone. Suck it up, buttercup. It's unfortunate, but it's just the way these things work.